So focusing on the golden hour, because there is so much of science in that 1 hour, what is happening in that hour. So I'm going to discuss that. And if I have some time, then I'll go more into nutrition aspect of 6 months and above. But let's just focus on, first golden hour. So what happens? We know about the 1,000 days, right? So 1,000 days. So out of 1,000 days, your 270 days are basically your pregnancy, correct? So in that pregnancy time, mother probably has nutritionist, mother has access to OBGYN doctors or whoever, any doctor that takes care of a pregnancy part, right? While pediatrician and nutritionist, they take care of the rest of the 730 days, right? So once the baby is born, that's when the pediatrician and again the nutritionist come in the picture. Now there is an overlap of about an hour. Okay, what is that hour? As soon as child is born, okay, and when the pediatrician is called in the delivery room to take care of the baby's initial important time, you have OBGYN in the room, you have pediatrician in the room, and you have that support which has been given by nutritionist to the mother during ANC. So she has that knowledge, right? So with three of us, we can basically influence at lifelong health. In a sense, for example, when we have birthday party, right, when child is born, child has first birthday party, second birthday party, and we kind of always arrange so much, we spend so much time making all this planning your birthday cake, planning food, planning party for birthdays, right? Think about it, you're bringing this newborn, okay, and the first hour you have this beautiful baby born in your hospital or in your PHC, and you have to celebrate it. And the way you celebrate it is by giving. Okay, what you're giving to the child, you're giving the perfect start. How are you giving the perfect start? Is basically as soon as baby is born, you're putting the child to mother's breast. That is called your basically breast crawl or skin to skin attachment, because that is going to give the perfect start, and you're giving that perfect gift to that baby, and it's lifelong. And let's see why it is lifelong, and that's why it's called golden hour, because you that hour will never come back, and the time lost in this 1 hour, you will never get it back, and it has a lifelong implications on child's health. And of course, there are a lot. Breast milk has, I mean, there is a whole science to it. In its optimum nutrition, it has bioactive component, it has host defense protein. But what I'm going to focus on is basically it is an important source of commensal bacteria for gut colonization. Okay, so what happens when the baby is born? Okay, the baby has a little bit of bacteria which is coming on from amniotic fluid, from mother's womb. And then when baby is pretty much has a little bit, but it's pretty much sterile. Okay, so now let's see what happens when the baby is sterile. So here, this is a gut microbiome with breast milk. We'll go a little bit more detail in exactly what happens in baby's gut when the colostrum passes on. So here is basically kind of a electron microscopic picture of your gut bacteria. Extremely small, and you will be amazed to understand gut microbiome, and it's like the whole world in human body. I'm going to focus on, of course, just babies. How many bacteria per ml of breast milk? 10,006 cells per ml. Okay, and 7 to 8 billion bacterial cells each day which are formed in the gut. What is the function of gut microbiome? So these are the gut microbiome which are being developed in baby because baby is getting breast milk. Okay, so what it does, it basically, this microbiome, it metabolizes the polysaccharide, which are basically your oligosaccharides which are present in the milk, and it results in synthesis of short chain fatty acids. Those are basically essential fatty acids, you guys know, short chain fatty acids, which are rich source of energy for the host. And basically it also involves in synthesis of vitamin K. It is important for formation of components of vitamin B. We also know B12. A lot of this gut bacteria kind of releases B12. It is also important for conversion of glutamine. Now, glutamine is basically an amino acid. It is important. This particular information is very important because there are new hypotheses coming in where what they're saying is basically gut microbiome of the mother and the baby is also probably related to your autism spectrum disorder. And autism rate is really going up, especially in America, and it's going up in India too. And probably they are thinking of this could be the reason of conversion of, so children who have autism, they have decreased conversion from glutamine to GABA. GABA is a neurotransmitter which is important in your brain. Okay, and then also gut microbiome is very important for a breakdown of various polyphenols. Now, as nutritionists, we all know that these polyphenols are so important. We get it from fruits, from vegetables, from green tea, and so many other amazing vegetables and fruits. But unfortunately, if you have a good microbiome, it's going to help you to break down these polyphenols. Okay. Another thing, microbiome is also important for detoxifying toxic products, and it also has effect on drug metabolism. So, for example, if child is taking any medication for any reason, then basically the microbiome in baby's gut will have an effect on your drug metabolism. So we have to basically we have to change the dosage depending upon basically gut microbiome. Also, which is one thing which is extremely important is your maintenance of structural integrity. So again, I'm going to explain a little bit more detail that what is the structural integrity of gut mucosal barrier, because gut is basically your there's one thing which is completely open to outside is your gut. Another one is your nose and your mouth, but mainly your intestine is completely open to outside. So whatever you're eating, basically if you don't have a proper gut integrity, if you don't have proper maintenance of those gut cells, then anything can get absorbed into your vascular system, into your blood vessels, right? So gut microbiome is extremely important for integrity of this gut mucosal barrier. Okay, and it also serves as a barrier. So it basically again, I'm going to go a little bit detail about it, how it causes barrier against all the pathogenic bacteria and viruses, not only bacteria, but a lot of other microorganisms. And it also important for development of host immune system. So look at all these effects that gut microbiome has. So you want to have perfect gut microbiome for that baby who is just born, because there are all these effects that baby is going to have. Again, we want to find out, okay, where do those gut microbiome come from? What are the sources of this microbiome? Because we want to have perfect one. So we want to have, it's like giving a perfect cake and perfect ingredient, right? So we want to have a perfect chain of events. The child gets a perfect start in her life. All right, so microbiota comes from amniotic fluid. It comes from meconium, basically, and meconium originates from uterus. So meconium is basically, a lot of time when the baby is born, when they pass stool, you will see that the green liquidy stuff that they pass in the stool, that is called meconium. Right, so it's, they can get those bacteria from meconium. It also comes from maternal vagina. Extremely important. This is really, really important to have a basically vaginal birth, to get again the perfect gut microbiome. Another time, sometime it also comes from maternal feces. It comes from skin, it comes from breast milk, and it comes from surrounding. Okay, so we want to have surrounding as clean as possible, and all these other factors are extremely important because it's going to give them mother's gut microbiome. Okay, so externally, from it can come from baby's mouth. So what happens is when the baby is sucking on breast, the areola, the bacteria which are present in baby's saliva, it can go back into in the duct, collecting duct, and it can go back in the mammary duct, and that can basically creates a lot of this reaction, and then it will basically go back to a baby. So that is, again, it's really another important source of microbacteria in mother's milk. And another way which some of the studies have found is what happens when there is a translocation of bacteria in mother's gut. So for example, mother's gut has, say, some of the good bacteria which can get which can go through a special pathway to mother's mammary gland. Can you imagine? This is such a beautiful way of nature's helping that baby to give the perfect microorganism from mother to baby. Okay, so this I will again discuss a little bit about the dendritic cells. So what are the dendritic cells? Okay, and these are the organisms which are found. These are some of the organisms which are found in breast milk. These are some of the organisms which are found in areola skin, and these are some of the organisms which are found in infant stool. So let's look at what is found in breast milk. So if you look at this pink color over here, pink colors are mainly a proteobacteria. So basically, breast milk, this was one of the study which was done by Dr. Pannaraj. Okay, so in that, what he found that mother's milk had a lot of this, proteobacteria. Uh, Areola skin. So mother's areola skin had all the skin bacteria. So skin bacteria are called your firmicutes. So what are your firmicutes bacteria? Your staphylococcus, your streptococcus. Those are all your, basically by and large, your skin bacteria. But if you look at infant stool, now infant stool had a lot more actinobacteria. So actinobacteria is your bifidobacteria. These are all basically your species of bacteria. So why do you think the infant stool has a lot more this bacteria? Although breast milk has proteobacteria, but what happened in baby's gut, that the infant stool has a lot more bifidobacteria. And that is because, again, this is I'm again going to go a little bit more in detail to understand exactly what happens in baby's gut. Okay, now these are all the different kind of bacteria that you see in children, baby's gut, and they all are different. So if you look at babies who are born by vagina, okay, so vaginal delivery babies, they have much higher level of species like lactobacillus, provotella, Schnitzia. These are some of the very good bacteria which are very important, in babies. And babies who are born vaginally, they have this really good bacteria. Now, babies who are born by cesarean, they have different kind of bacteria. So if you look at their gut microbiome, they will have more of staphylococcus, again because the skin is cut, right? So you will have a lot more this staphylococcus, corynebacterium, propionibacterium. Those are the bacteria that you see in babies who have C-section. And the babies who are formula fed, now, those formula-fed babies have completely different bacteria. So they will have more of a bacteroids, Clostridium, a lot of this other, more of a pathogenic bacteria, which will cause a lot more problems. So you will know, like, a lot of time when we give formula, and those babies are crying a lot, they may have a lot more gas, they have a lot more bloating. It's because their bacteria are completely gone haywire, right? And mothers who get antibiotics, so babies who get antibiotics, or during delivery, pre-delivery, those babies have different bacteria. So look at the bacteria change in different bacteria, right? And also when you're weaning the child, when you're starting the complementary food, depending upon what kind of food you are starting, children will have different bacteria. So these are the bacteria where child is given a lot more high fiber food, they will have more of Provotella, versus children who are given a lot more, like a high fat animal protein diet, they'll have a bacteria. So they'll have a different bacteria. So basically your bacteria will change. And by and large, by 3 years of age, children's bacteria is pretty much similar to your adult gut bacteria. Okay, now let's see what happens now, how the nature kind of prepares his baby to come on the planet Earth. Okay, so let's see how the mucosal immune defense develop. So here, so this is basically baby's intestine. Okay, this is the intestinal wall. Okay, now here, what the first thing what we have in our intestinal gut cell lining, this is the M cells. M cells, it looks like M, right? So this is important, these are M cells. Then you have something called, these are all Peyer's patch. So these are your lymphoid Peyer's patch. Number two, these are your Peyer's patches. You have basically your T cells, your B cells. These are all your, your cells, basically, your immunological cells, right? Then you have your third one, is your lamina propria. This was your, basically cells which are present just outside the cellular, this thing. And they again have a lot of this plasma cells. They have the CD4 T cells, again, those are all the immunological cells. And then you have intraepithelial lymphocytes. So these are your intraepithelial lymphocytes. So these are, all these cells are extremely important, to basically start the immune function. Because babies, absolutely, imagine baby was in mother's womb, baby was protected by mother's immunity, right? Now baby's out, baby has to function on his own. So baby requires that little bit of stimulation, to have the immune function stimulated, right? It's just like, for example, if we get, say, viral load of COVID, right? That's when what's going to happen. Suppose if you are exposed to somebody who has COVID, what's going to happen in the body? Your body is going to react, right? Now here is a foreign virus coming into your body. Your body's immune function is going to start reacting very fast, right? It will start increasing your T cells, your B cells, all this, you must be understanding all the cytokines and all this levels go up, right? Exactly similar way, when the baby is out from mother's womb, baby is now preparing, or nature is preparing baby for that immunity, right? Now to increase that immunity, basically baby will require that stimulus. Baby will require something which will basically tell body, okay, you start immune function and protect this baby. Okay, so this is what it is. Now again, going back a little bit more into science, so what happens, so once the baby takes this milk, mother's milk, which has mother's good bacteria, so those bacteria has an effect on this columnar epithelial cells. So the one which I showed you over here, so how it affects the columnar epithelial cells, this is the slide over here. So what it does, so first thing what it does, it basically creates this microvilli. So do you see this microvilli over here? These are columnar epithelial cells. This is a gut lining. This is our lining. Okay, this is basically your lumen. This is your gut lumen. This is where the milk comes in. Okay, and this is your basically just underlying the gut cells, your columnar cells. You have a lot of these immune cells over here. Okay, so all these immune cells are waiting for something to stimulate them so they can start acting up, right? So the first thing what the bacteria in mother's milk, which it does, it tells columnar epithelial cells to basically have a microvilli extension. So here this is important, the microvilli extension. It is not only important for absorption of your lot of nutrients, as you guys know, but it has other functions also. Second thing what it does, normally kya hota hai ki when you have this columnar epithelial cells, right? These are all the cells. Normally in the newborn, fresh newborn, there is some gap in between this columnar epithelial cells. So they are not attached to it. There is no adhesion. There is little bit of gap. So now you have this, suppose you have a gap. So anything that you put in the mouth, a lot of things which should not get absorbed from that food that you're eating, it will get absorbed because then you have this gap. But thanks to bacteria in mother's milk, immediately that gap becomes sealed. So do you see there is a seal? So it seals them. So this is the first level of defense. It's like literally, your soldiers coming one close to one another and saying, no, we will not let you in. Right. So this is the first level of defense. The second level of defense, what it does, basically it tells a lot of the cells, like there are different cells in your columnar epithelial cells. You must have already known this. There are Paneth cells, there are goblet cells, there are all these different cells, right? So what it's going to tell all the cells to start producing something called glycocalyx, also called mucin. Okay, mucin, like a mucus layer. So now it has this beautiful mucus level all over the columnar epithelial cells. This is just second level, because what happens, basically it will be very difficult for any bad bacteria to go into the epithelial cells. You don't want any bad bacteria. So this is a second level of defense where basically, it will not allow anything to enter your columnar epithelial cells, right? Third thing what the bacteria will do, it will basically cause a stimulation of these peptides. Okay, these peptides are basically formed from your amino acids, as you know, right? And then what it will do, it will basically, those peptides are very important for as an antimicrobial effect. So it has an antimicrobial effect. Fourth thing what it will do, basically, it went. So do you see this area? This is, do you remember that we spoke about M cells? There are M cells, right? And I told you to remember those M cells. Now there is one particular area in your intestine and baby's intestine where basically there is no mucus production. There is no mucin, there is no microvilli. Why do we have that? Because it's important for this immune cells to get exposed to mother's bacteria, right? So if you have everything covered, you will not have stimulation of this immune cells. So here this M cells will allow basically your good bacteria and your bad bacteria to enter the intestinal wall, and then basically it'll stimulate all your cells underneath, right? So this is important. Now, one more thing which is really important is your DC. This is basically your dendritic cells. Remember, I talked about dendritic cells. So dendritic cells are special cells, and what it does, it basically kind of attaches the good bacteria, probably like a commensal bacteria, and then it takes it inside, and then basically exposes all these other cells to those bacteria, right? So this is another very specialized dendritic cell. So this is the basis of your immunity. That how, now let's see what happens when mother's milk comes in, right? Now this is the beautiful picture that I found from one of the study that I was reading, and it's the electron microscope of the microvilli. So this is your columnar epithelial cells. Okay, this is the cell, and these are all the microvilli, right? So it's a beautiful picture. Okay, so now what happens? Now let's see how the immunity develops. Okay, so here I discussed about those columnar epithelial cells, right? This is your dendritic cells, right? So what it is doing, it is basically taking all these bacteria and it is bringing into subepithelial area, right? There where you have those lymphocyte cells. Now, normally what happens initially, you have this T helper cells, which are naive cells. Naive cells means they are not exposed, okay? And then normally क्या होता है कि you have there are different T cells of naive cells are basically get converted into your T helper 1 cells, T helper 2 cells, T regulatory cells. These are basically, so it starts stimulating, right? And normally babies born with lot of TH2 cells. So here if you look at it, where is my person? Yeah. So basically, normally they have predominance of this cells. Why? Because there should not be any rejection when the baby is developing in mother's womb. There should not be any rejection. So not to have a rejection, basically what nature has done, there is predominance of TH2 cells, so there is no rejection. But once the baby is born, now baby is out of mother's womb, there has to be regulation. So you can't have TH2 like dominance. Otherwise, child will have lot of autoimmune diseases, lot of allergies. So what it has to do, it has to basically make basically balance all this TH cells. Okay, and another thing what it does, again, it also takes this bacteria to your B cells. Okay, now what is the function of B cells? B cells are important for your IgA, right? So what happens, basically the IgA gets secreted, and that IgA helps with, it contains bacterial attachment and penetration. So your secretory IgA is extremely important. And I just read a paper yesterday where they found that children who, like younger children, the reason they are not getting COVID infection, because they have very high level of secretory IgA, which prevents the attachment of bacteria and virus to your cells, to your the cells, right? So that's why it's important that children get the right, and obviously you want a mother's bacteria to stimulate all these cells. You don't want cow milk or formula to stimulate all the cells, right? Okay. So now there is another very beautiful presentation on development of immune tolerance. What about immune tolerance? Means, suppose if you're exposed to any allergens, right? So it could be allergens to any food, like allergens. You have to develop that immunity so that you don't have those reaction. Imagine if somebody had anything in there, had allergic reaction, right? So that's called basically immune tolerance. right? So here again, talking little bit about science, because this is again, I find it extremely important and very interesting also. So if you look at it, I spoke about the DC, which is your dendritic cells, right? So and this is mother's milk. So mother's milk have your microbiota. So I spoke about all the bacteria that it has. I also spoke about some of this microbial proliferation. So it has human milk oligosaccharide, which I'm going to talk about a little bit later, and it has a lot of other antimicrobials, right? So they all kind of work in synergy, okay, and then basically it helps in prevention of allergies. So let's see what it does. So any antigen is basically taken up by your dendritic cell, okay, and it basically is taken to lymph node. Remember I told you that it takes those bacterial cells to those lymph nodes and those cells, and it stimulates your transforming growth factor, which basically induces, remember I told you about again the knife cells changing into T regular, all that. So this is one reaction which is happening, when mother's milk is going in, right? Second reaction, what is happening, there is something called interleukin 22. Okay, this are again, you must have read a lot about COVID, you must have read about a lot of this interleukins and cytokines and all that. So of course you don't want too much of cytokines, but you need some amount of cytokine to fight your infections, right? So another thing what happens is there is a production of the interleukin 22, okay, and that interleukin 22 is extremely important. Why is it important? Because it is important for formation of this peptide. So remember I spoke about the peptide, it produces this peptide, okay, and this peptide production results in your making of your mucin production, the lining of the gut, so for that interleukin 22 is very important, okay, and that is basically, it is important for strengthening of gut barrier. Okay. Third thing, what it does basically, this particular gut barrier, the mucin, will prevent the transfer of dietary antigen across the barrier. So then you will have this beautiful layer. It will not allow any antigen to enter. Okay, and for that you need that interleukin 22, which will stimulate your goblet cells. It will stimulate your Paneth cells, and it will produce your mucin production. Then there is another enzyme. Okay, there's an enzyme basically, it's called indolamine 2,3 dioxygenase. So there is we call it IDO. Okay, I know I'm going that's a bit too into detail, but this are, I think, a really interesting topic that we have to, if we understand, we will never let child have anything but colostrum, that too within half an hour. Okay, so there is an enzyme called IDO, and which get activated in response of allergen. So if there is a exposure to any allergen, this IDO gets activated. Okay, and then what does IDO do? It metabolizes. There is a few, I mean, of course you guys know tryptophan, right? That's another amino acid. So what it does, it basically converts your tryptophan to kynurenine, okay, and which has the tolerogenic effect. So again, basically this kynurenine is extremely important in baby, and that will prevent basically any immune reaction. Okay, and what it does, it again basically kind of affects your Tregs. Okay, and this is how it's going to prevent allergy. So these are few of the components which are important in prevention of allergy development. Okay, and being a nutritionist, we guys know that it's so, I mean, a lot of time people have so many allergies, and now when you ask them, do ask them one question. Ask them that when you were born, where in how much time did you get mother's milk? Whether did you get mother's milk or did you not get mother's milk? If you did not get mother's milk, what did you get? All these things, if you ask the question in a lot of people who have allergies, by and large you will get the answer that they were not fed colostrum right away. Okay. Another science which is coming up is your microbiome, gut and brain axis. Okay, so what happens basically, again, you must have kind of studied in your nutrition, that sometime when we are very stressed, right, when you are extremely worried, if we have exams, a lot of time we have stomach pain, we have diarrhea, we have like nausea like feeling. Why do we have that, right? Think about it. So I mean, basically, of course, there is a autonomous nervous system. You have vagal nerves. You have all this basically connection between gut and your brain, right? So it's similarly when you have basically issue with gut, through a lot of this nervous connection, especially vagal nerve, a lot of this metabolite of gut microbiome basically can affect brain. So what they are saying in a lot of the research, recent articles, they're saying that if there are a lot of neuroimmune conditions like multiple sclerosis, Alzheimer's, autism, anxiety, depression, stress, all this, lot of the disease are probably involved because of gut microbiome. I mean, of course, nothing is proven as yet, but as more and more studies are coming out, it just is amazing. So again, let's see how it functions. Okay. So as I mentioned, it's basically like a bidirectional biochemical communication. Remember, I spoke about GABA, like how your gut microbiome is important for formation of GABA. It is also important for formation of serotonin. Now, if you remember, serotonin is another neurotransmitter. It's important for happiness, right? If you have a low serotonin, you will be depressed, you'll be sad. So it's really important to have this really important your neurotransmitter serotonin, right? And basically so your gut microbiome influences all this production, expression of all these important neurotransmitters. So imagine if you don't have, you will have of course you will have some neurological issues, right? uh, this one is also important. Remember, I mentioned about the intestinal barrier and tight junction. So if you don't have those tight junction, basically a lot of this toxic metabolite can pass through hypothalamic pituitary adrenal axis and cause issues. Okay. uh, Another important thing about short chain fatty acids. So again, as I mentioned, short chain fatty acids, serotonin, kynurenine, they all have effect on brain. Okay, so think about it when you're putting anything in your mouth. I'm not talking about babies now, I'm talking about adults. You don't want to do anything which can affect your microbiome, right? Because it has effect, and you will see it. Like a lot of time when you eat something, when you have bloating, next morning you will wake up, you'll have headache, you'll have something called brain fog. So you will notice it. You have to now kind of really, be aware of a lot of the symptoms which you may not realize. Okay. uh, okay, so again, picture depiction of how the hypothesis of autism and gut dysbiosis. Again, nothing is proven. This is a hypothesis, but this was another very good, beautiful article that I had just read 3 days ago. And this is again, this is the altered gut microbiome, and mothers and babies, and then basically it affects your brain, through various signals, various pathways. Okay. Now, another thing which is really important is all these bacterial cells that we have, okay, in our gut. So we live in harmony. Okay. When we have good bacteria, we have good immunity because it's going to protect us. Okay. When we have good immunity, we'll have a better bacteria, and those bacteria will. So it's like a full synergy, right? When you have a dysbiosis means your commensal bacteria are lower and your pathogenic bacteria are higher, right? So now you will have a lot more this gut problem of bloating, irritable bowel syndrome, diarrhea. Then of course you eventually what you're going to develop a lot of your immune disease, because your gut lining is not, your gut lining is not well prepared. It has all these holes. Your mucus is not protecting, your mucus level is gone, or mucus layer is gone. Then a lot of these toxins are getting absorbed, right? And then your body is reacting, and you saw there are a lot of these B cells, T cells waiting just underneath your intestinal wall, to react, right? So then basically people who have a lot of this gut microbiome problem, they are at risk for atopic dermatitis, they are at risk for food allergies, IBD, necrotizing enterocolitis, which we see in pediatric and NICU. We see it all the time in small babies. We see necrotizing enterocolitis. We see metabolic syndrome, and there's so much of information out there on gut microbiome and disease, right? But if you have excellent gut bacteria, you're eating right food, babies are getting colostrum, babies getting mother's milk, mother is eating right kind of food, then obviously baby will develop immune tolerance, baby will have intestinal homeostasis, there'll be healthy metabolism, right? So it's basically like a win-win situation. And it's very important to keep ourselves in a synergy with the gut microbiome. right? Now let's see what affects gut bacteria. Now I spoke a lot about what exactly it does in the body. We want to make sure that we protect it, right? So in babies, how will you protect those gut bacteria? You want to have a positive, so green, all your green factors are your positive factors. So you want to have a proper vaginal delivery as much as possible. Of course, maybe 15% of the time mother may need cesarean section, which is okay, but I see that most of the time, like almost just the other day, there was a news that 57% patients in private get a cesarean section. So you want to ask gynecologist why I'm getting cesarean section. So just kind of be on top of it and try to get as much as possible vaginal delivery. Okay, there are complications. Obviously, there is no choice. Then you want to have as much as possible term delivery, because babies who are born premature have a different gut microbacteria, right? Then you want to have skin to skin touch, skin to skin attachment, breastfeeding right away within as soon as possible. If possible, as just dry the baby and put the baby. We have a beautiful video on spoken tutorial. You want to avoid antibiotic as much as possible. So avoid antibiotic in mothers, avoid antibiotics in babies. What will alter this gut bacteria? Cesarean delivery, okay, preterm delivery, early bath, okay, lack of skin to skin contact, formula feeding, and antibiotic exposure. So formula feeding also includes cow's milk. Okay, so any milk other than mother's milk will create a problem in gut bacteria, and if there is antibiotic exposure. So you want to prevent all this as much as possible. Okay, these are again some of the other factors which can create gut disruption and causing asthma, atopy, diabetes, all that. Of course, later on, diet is also very important. So child may have perfect nutrition for 6 months and then they continue breastfeeding for 2-3 years, but if they start food which can be damaging to gut microbacteria, and some of them are like sugar, jaggery, omega-6 loaded fatty acids, a lot of this are trans fat, a lot of these things are very detrimental to our gut microbiome. So we have to be very careful what we are putting in our stomach. Okay, this is another article which just came out just few months ago, and what they found is a lot of time, when mothers come to us, they said, "Can I get a pump? Can I just pump the milk and give the baby through vati or chammach or bottle?" So in this study, what they found is mothers who were pumping their milk and giving the milk through bottle, those baby had different microbiota than the mothers who were directly attaching. So remember, I told you when you have a direct attachment, that areola mycobacteria, areola bacteria is also very important. So those bacteria were not going in mother's milk, and also what was happening, basically there was probably a lot of contamination of breast pump. So however hard you try to clean it, it's not direct mother's milk going into baby. So those babies had different gut bacteria. So this is important to understand. And what is dysbiosis? Dysbiosis, as I said, is basically, when there is a symbiotic relationship is lost, that's when it's dysbiosis. Means you have a lot more pathogenic bacteria than your normal good bacteria. And what are the implications? Though these are the studies which have been done so far. So again, high risk of infections, asthma, celiac disease. Again, very good study which came out, almost 30 to 40% reduction of celiac disease in mothers, babies who got mother's milk. Okay, so it decreases the prevalence of celiac disease also. Your IBD, autoimmune diseases, your irritable bowel syndrome, IBD is inflammatory bowel diseases, obesity. Look at this, all this, so many. And this one is the new, really, too much going on in this arena of neurodegenerative disorders and your mental disorders, right? So autism, stress, depression, schizophrenia, Parkinson's. So if you get chance, you do kind of reading on this articles on gut microbiome and neurodegenerative diseases. Now, okay, so now we spoke about bacteria, right? We always say, okay, which is a good prebiotic, which is a good prebiotic, what should I do for my gut? But you won't believe it, as God has given beautiful bacteria in mother's milk, God has given food for that bacteria. Okay, that is called prebiotic. That's called human milk oligosaccharide. So it's amazing. The nature is just mind blowing that God has given perfect kind of uh, food for those beautiful commensals, like a good bacteria, right? So you guys know about prebiotic definitions. I'm not going to go too much in detail, but basically, those are food for your for bacteria, and basically, it allows the specific changes. It basically allows the change in composition and activity of microflora, right? So these are human milk oligosaccharides. Lot of effects on again gut microbiome and also on intestine. Very interesting. So again, I'm going to go a little bit in science. So this is your uh, your structure of human milk oligosaccharide. Okay, so it has fucose, it has sialic acid, it has N-acetyl glucosamine, galactose, glucose, right? So this is your structure of HMO. Um, what are they? They are glycans. Okay, they are basically found like abundantly in breast milk. Colostrum has high amount. You see, look at this: 20 to 23 grams per liter of HMO in your colostrum. It goes down as when the mother starts getting mature milk, right? Preterm babies have higher amount of HMO. Why? Because those babies need lot more protection from infection. They need lot more protection from lot more other allergic conditions, right? Because many time what happens, preterm babies, they get formulas, right? And that as soon as we start formulas, especially in the US, a lot of these babies, they develop something called necrotizing enterocolitis. So again, I'm going to go a little bit detail in that, what happens when we start not start mother's milk and start formula. And then what happens, this HMOs, they have to be resistant to gastric acidity, because those are food for microbiota which are present more in the lower intestine, right? So it has to be done is it has to resist to gastric acidity. It has to be prevented from hydrolysis by enzymes, and it has to be prevented from absorption. So it has to go intact lower down in baby's intestine, right? So when those HMOs reaches distal small intestine, uh, and they end the colon, they are intact and at a very high concentration. Okay, and then some of the bacteria, they grow well on this HMO. Some of the bacteria, they don't grow well. Okay, and then this bacteria, they produce short chain fatty acids. So remember I told you about the short chain fatty acids. Those are metabolites. Those are powerful metabolites. Okay, and if you read a little bit more about short chain fatty acid, there's like a whole kind of bunch of 100 papers that you'll find on effect of short chain fatty acids on our body, right? And basically what it does, it favors the growth of commensals over potential pathogens. So it allows basically good bacteria to grow, and it prevents the bad bacteria to kind of die down. Okay, so now again, there's a little bit of science. I'm going to go directly to, I'm going to explain this because this is what I've explained on the previous slide. So what it does, so these HMOs are basically food for good bacteria. So these are your green ones are your good bacteria. The purple ones are your bad bacteria. So when you have food for good bacteria, and it basically bad bacteria does not have HMOs, so they're going to die, right? Without food, they're going to die. So obviously you want mother's milk and baby, because if by chance if baby's getting bad bacteria from say somebody's dirty hand, or if somebody put touch the baby or put finger in baby's mouth, all these bacteria which are going in baby's stomach, those are most likely bad bacteria. So if you have a human milk oligosaccharide in mother's milk, basically those bad bacteria will not going to survive. Okay. Second thing, what it does, it basically it acts like a decoy. Decoy means it basically the cells over here, they look like your epithelial cells over here, so that all those bad bacteria get attached over here, and then they take it away from columnar epithelial cells, right? So it works like a decoy. It basically kind of trick the bad bacteria to go away from your epithelial cells, right? So it does not get absorbed. Then what it does, it causes the cell modulation. So this is where there is an immunomodulation, where basically, it allows your plasma cells to produce IgA. So there are a lot of this epigenetic factors that it does. So there's a lot of immunomodulation. I again don't go too much in detail. Okay, this particular one, this I mentioned. Okay, babies are born with T helper cell 2 predominance. Okay, because they don't want to get rejected in baby's mother's womb. But when you have a human milk oligosaccharide, it try to basically, you see how it causes balance. So there is a balance of this. So not only those gut microbiome causing balance, but also human milk oligosaccharide, that also causes balance of this TH1 and TH2. This will prevent allergies in future. Extremely important step in baby. Okay. Now this E1, this is what happens. So you remember that we have neutrophils, we have WBC, we have all the cells, right? Those are all cells which kind of comes in when there is an infection, right? But you don't want too much cells going into your cell in your epithelial cells, right? So these are basically your neutrophil. These are your neutrophils. So what basically HMO does, it prevents basically the rolling of the cells on the endothelial cells. So these are your endothelial cells. It's preventing the rolling, right? So when you prevent the rolling, then it will not allow the neutrophils to go into your vascular system.
Welcome to the spoken tutorial on the importance of golden hour and colostrum feeding. In this tutorial, we will learn about golden hour and its importance, benefits of feeding colostrum to the newborn. Let us begin by understanding what is golden hour. Golden hour is defined as the first hour of the newborn after its birth. This first hour is very critical for the child's growth and development. It is also an important factor in a mother's breastfeeding journey. This period helps to strengthen the bond between the mother and her infant. An uninterrupted skin to skin contact should be initiated between the two. What is skin to skin contact? Skin to skin contact is the best way to initiate early breastfeeding. The infant will attempt to crawl and latch on the mother's breast by itself. This is known as breast crawl, which is explained in detail in another tutorial. Next, let us look at the different stages of breast milk and its composition. The breast milk goes through 3 main stages. These stages are colostrum, transition milk, and mature milk. Each stage is best suited for the changing and growing needs of the baby. We will learn in detail about the first stage, which is colostrum. Colostrum is the earliest breast milk produced. It is thick, sticky, and concentrated milk. Its color can vary from creamy white to light yellow or dark yellow. It is so precious that it is also known as the liquid gold. Beta carotene present in colostrum is responsible for its yellow color. The breasts begin to produce colostrum in the 12th to 16th week of pregnancy. It starts getting secreted from the breast after delivery. This special milk is secreted only until first 2 to 4 days after delivery. It is secreted in small amounts, about 40 to 50 ml only on the first day. This is about 3 tablespoons of milk. Milk starts to be produced in larger amounts between 2 to 4 days. On the third day, the milk supply increases to 300 to 400 ml. This is about 20 to 25 tablespoons of milk. Even though colostrum is secreted in small quantities, it is very nutritious. It is easy to digest, which makes it the perfect first food for the infant. It is high in proteins and low in carbohydrates. It is also rich in good fats. These good fats are essential for the growth of the newborn baby. It is also required for proper development of the baby's brain and eyes. Infection fighting elements are also abundantly present in colostrum. For example, antibodies, lactoferrins, lactadherin, and leukocytes. Growth and protective factors are also there. In addition to this, it contains high amounts of vitamin A, E, B12, and K. A large number of white blood cells are also present in the colostrum. It strengthens the baby's immune system and helps fight disease-causing agents. It contains components which help fight bacteria. Colostrum provides immense benefits to the newborn. Let's look at each benefit one by one. Colostrum is the natural first immunization for the baby. Immediately after birth, the newborn is unable to produce its own antibodies. Feeding colostrum is important as it is particularly rich in antibodies. For example, immunoglobulin A, M, and G. Among these, immunoglobulin A, known as IgA, is the most important. They coat the areas of the baby's organs which are prone to infections. For example, lining of the throat, lungs, and intestines. IgA binds to the germs and neutralizes them. This prevents the germs from entering the baby's blood. Colostrum helps in regulating the baby's immune system. It balances the levels of T helper cells in their body. An imbalance in T helper cells can result in allergies and autoimmune diseases. In autoimmune diseases, the immune system attacks the healthy cells in the body. More than 70% of our immunity lies in the gut. Colostrum has a huge role to play in the gut health of the infant. It helps in diversifying the baby's gut environment. This helps in prevention of allergies and asthma later in life. It reduces the risk of inflammation of the intestine. The risk of stress and depression is also reduced. Let us understand how colostrum is beneficial for the gut of the baby. A newborn baby is born with a leaky gut. There are gaps between the cells of the inner lining of the intestine. Through these gaps, viruses, bacteria, and allergens can enter the baby's body. Colostrum seals these gaps so that no harmful pathogens can pass through. The lining of the cells of the intestine has a brush-like border. This is known as microvilli. Colostrum stimulates the development and extension of these microvilli. This helps in increasing the absorption of nutrients. Colostrum increases release of mucin from the cells of the intestine. Mucin forms a layer on the lining of the intestinal walls. This prevents the entry of any bad bacteria. The colostrum also contains human milk oligosaccharides known as HMO. They act as prebiotics. This means that they promote the growth of good bacteria in the baby's gut. They block the pathogens from attaching to the cells of the intestine. They are also beneficial for the development of the baby's brain. Feeding colostrum to the infant prepares his stomach for digestion. It acts as a laxative to help the baby pass meconium. Meconium is the first dark black or dark green stool of the infant. It gets built up in his bowels during his time in the mother's womb. Passing this meconium early will also help in preventing jaundice. Meconium contains bilirubin. The laxative properties of colostrum will help him flush out the bilirubin. If the infant isn't fed well, the bilirubin is reabsorbed from the bowels. It then builds up in his body and results in jaundice. Another property of colostrum is that it has a high number of growth factors, such as insulin-like growth factor 1 and insulin-like growth factor 2. They are required for tissue development, repair, and growth. Another growth factor which is high in the colostrum is VEGF. It is called the vascular endothelial growth factor. It promotes the growth of new blood vessels. The colostrum is also a major source of epidermal growth factor. It is very important for the normal development of the baby's intestine. It is also essential for repair of the intestine's lining in case of an injury. Thus, it provides protection against intestinal disease in newborn babies. For example, necrotizing enterocolitis, which is known as NEC. It is a condition caused due to inflammation of the intestine. Feeding colostrum also helps to prevent low blood sugar levels in the baby. Hence, colostrum feeding is beneficial for the baby. There are a few myths regarding colostrum feeding. The first myth is that colostrum should be discarded because it is stale. This is not correct. Colostrum is neither stale nor is it harmful for the baby. On the contrary, it is very essential for the newborn. It should not be discarded even if there is a delay in breastfeeding. Any delay in breastfeeding the baby will cause a delay in colostrum production. For example, delay due to poor attachment of the baby to the breast. In this case, the mother can express her colostrum and feed it to the baby. She can express using press, compress and release technique. This will prevent unnecessary feeding of prelacteal feeds to the baby. Prelacteal feeds are any food given to the newborns before breastfeeding is started. For example, honey, water, jaggery, herbal paste, animal milk, formula milk. These foods deprive the child of essential nutrients. It also increases the risk of infections in newborn babies. The second myth is that the quantity of colostrum is less and insufficient. Some people may believe that is not enough for the baby. Many women interpret that their breast milk production is inadequate. This is not correct. The breast milk production is usually in line with the infant's needs. Infants require very small amounts of milk in the first few days after birth. Their stomach can hold about 20 milliliters on day 1. Thus, the mother should continue feeding frequently. For the first few days, the infant should be breastfed around 10 to 12 times a day. Gradually, after a few days, the milk production will increase. On the 5th day, the mother's breasts start producing transitional milk. It is the second stage of breast milk, which is bluish white in color. It is produced until 2 weeks after delivery. It contains a mixture of both colostrum and regular breast milk. After 2 weeks, the breast starts producing the mature milk. It is more watery as compared to colostrum and transition milk. Though it is less concentrated, it is still nature's perfect food for the baby. Remember that exclusive breastfeeding should be done up to 6 months. When the baby completes 6 months, complementary food should be started. It should be given along with breastfeeding. Breastfeeding should be continued till 2 years or beyond. The benefits of it last a lifetime for both mother and the infant. This brings us to the end of this tutorial. Thanks for joining.